Okay. Now, the second one, constipation. Okay, we really should have got the Palcare guys to talk about constipation. But rehab guys are obsessed by bowels as well and constipation, okay? We really are. Now, some of you guys who aren't nurses and doctors might think, what are we going on about? Is it really worth worrying about? And this is a bit leading. Who's going to say it's not? Oh, come on, somebody should, okay? Okay, look, it really is worth worrying about. Now, where's my next slide? Yeah. In MND, okay, and in other patients, I've had a number of people end up, not an insignificant number, in emergency and acute departments under surgeons and gastroenterologists with acute abdomens due to severe constipation. I'm talking, this is a very unpleasant thing to go through, and if it can be avoided, it's something probably nobody really wants to experience in their life. So, they go via one of these things and they go to hospital, and they can be there for sometimes a week or two, and often they need to come to rehab afterwards to get a proper, bowel regime, get it all sorted out. Okay, so the reason I mention this to everybody, I think it's just worth being aware of it, mentioning it to patients. This is serious. It's not just inconvenient, annoying, embarrassing. It can end up being, and it often does in MND, an acute, very painful, very unpleasant emergency. I can think of so many puns, which I won't. I've been too busy of late. So, who thinks we should be aggressive managing constipation? Nobody? Put your hands up. Yeah, I think so. I'm really glad I'm not one of your patients, okay? I think we should be determined, okay? Much better, okay? We should treat it seriously, but nobody needs to be aggressive, Sorry, I tricked you. Okay, so it's a very similar approach. Again, I won't go into the minutiae of it, to secretion management, okay? So constipation is, really it's about fibre, it's about hydration. And I'm convinced, although there's no way of really knowing this, I've had a few chats with people, I don't know how you'd do some physiological study, that MND itself actually, like a number of other neurological conditions I'm involved with, affects the bowel. So I think they're particularly prone to it above and beyond the normal everyday, all of us being prone to constipation if we don't get enough of this and this. So I think it is something that we need to be very aggressive with. However, MND patients get bulbar symptoms. Sometimes they have trouble with this. Well, yeah, and often they have a lot of trouble with this. And sometimes, reasonably early in the case, it does get to the point where you really can't manage it in the community, without some sort of medical intervention, because oral intake's just not sufficient. So that's when we go, this leads into advanced care planning.